Good afternoon, and welcome to today's Covering COVID-19 in Indian Country virtual roundtable. This webinar is the first in a series of webinars hosted by the Native American Journalists Association that will discuss and examine the unique challenges of covering the global coronavirus pandemic in Indigenous communities. Today's roundtable will focus on the unfolding crisis in Navajo Nation, and we are honored to host a panel of journalists at the center of this story. This webinar is being recorded and streamed on Facebook Live, and the recorded video will be posted to the NAJA website, the NAJA Facebook page, and the NAJA YouTube channel. We encourage all attendees to submit questions at any time during the roundtable using the Q&A function. The panel moderator will pose these questions at the end of the presentation. This roundtable series would not be possible without the generous support of our sponsors, the Ford Foundation, Knight Foundation, Democracy Fund, and the Google News Initiative. We thank all of them for their continued support. Our panel moderator will be Mary Hudetz, a former president of the Native American Journalists Association and current investigative reporter at the Seattle Times. Mary will lead this important discussion and introduce our esteemed panelists.
Thank you, Brian. And good afternoon, everybody. I am very happy to be here. As Brian noted, this is the first, just the start of a conversation that NAJA is planning to hold over the coming weeks on covering the coronavirus in Indian Country. And I'm very heartened today that our conversation is beginning with the work of looking at the work of our colleagues on the Navajo Nation, who I think are and know are very dedicated to covering and serving their communities. And they have shown that perhaps more than any other time in the past several months. Their work and the work of many colleagues has underscored public service, aspect of community, local, and Native journalism. And thanks to the breadth of their experience, we'll be able to have a conversation today about decisions for running a publication during this time, on-the-ground reporting, and data collection. One quick additional housekeeping note for our audience. I'm going to reserve the last 15 to 20 minutes of the conversation for audience questions. But at the same time, you are welcome throughout the hour to submit through the chat box questions that might come up for you along the way. So with that, let me introduce our panelists. Starting off, we have Tom Arviso today. He's the publisher of the Navajo Times. Donovan Quintero is an award-winning writer and photographer for the Navajo Times. Noel Smith, a veteran reporter for the Farmington Daily Times, which is part of the USA Today network. And Bennett-Begaye, who is the deputy managing editor for Indian Country Today. Tom, I wanted to start with you. Okay. As the leader of a publication, the Navajo Nation, which publishes weekly for your coverage area. I was hoping you could take us back to the start of the outbreak in your communities. Right. Yeah, and the unfolding of that situation and some challenges, one or more, that you navigated along the way.
Well, first of all, thanks, Mary. I want to say hello to everybody that's out there watching us today, and I really appreciate NAJA doing this panel discussion. And I'm really honored to be on this panel with these great journalists that are here with me. I think at the beginning, when the coronavirus pandemic first broke, I think one thing was really coming to grasp just how serious the whole situation was, and trying to figure out exactly how we were going to be able to continue to publish a newspaper, to continue to operate as a business. And all of that was coming in all different kinds of fashions, all different kinds of situations, just coming one after another, one after another. And so as the publisher and CEO, I was trying to have some balance and trying to figure out how we're going to, continue to be a news source for our people. And so, one of the first things you need to do really was take care of the health and safety of your employees. And that was the number one objective. How are we going to make sure our staff, our employees were safe? The second thing was, how are we going to be able to operate as a newspaper, as a staff, so that we could continue to publish a newspaper? So all these different things came into play. And as a result, though, we kind of come to realize now that we can all work from different locations. We can work remotely when we need to. We have staff now working on a flex schedule, so we're not all here at the same time. I'm actually in my office in Winter Rock right now, okay? And so, all these different factors about trying to run our business, but to also to be able to still get the news out to our readers, to our Navajo people, to all of our readers. And also to work with our advertisers. A lot of the businesses got shut down, or they were really restricted in what they could and couldn't do. And so we had a lot of, business to take care of in regards to not being able to, like our casinos shut down. So a big chunk of our advertising went out the door because they were unable to, run their business. But there was just a variety of different things that we had to weigh and really kind of, put in perspective as to what we needed to do first. And like I said, the safety and health of our employees was number one. And then having a protocol, setting up guidelines for your office and how to operate so that everybody was safe. And then that allows us a little more freedom, a little more room to go out and do our jobs, which was, ultimately what we were all about trying to do, was to continue to, provide a news service and be of service to our people. Okay.
Just in the past week, I believe you wrote a column for your newspaper noting one of perhaps the biggest challenges in the Navajo Times, for the Navajo Times in a long time, which was making a decision to halt publication of the print product.
Right.
Could you outlined, I think, the necessity for a print publication on the Navajo Nation,
right,
even in this time when digital is expanding, in part because of internet access.
right.
I just wondered if you might tell me about that, how you worked through it, and maybe how you got the news out.
Okay. Well, that was a big decision. What happened is that, after we were into, working and dealing on covering the coronavirus for like 3 months, and we were being as safe as we could here at the office and with our staff. But, ultimately, lo and behold, 2 of our staff tested positive for the coronavirus. And as a result, we had to take measures to make sure that, our office was safe. So we had to shut down the whole operation for 2 weeks, for 14 days. And that's what we did. I had to have the whole office cleansed and sanitized, which we did. All of our staff went and got tested. And I'm happy to say everybody tested negative, other than the 2 that originally were positive. But as a result of that, though, we weren't able to print, because our press room and our back circulation area were 2 of the areas that got compromised from the 2 employees that tested positive. So we basically decided we're not going to have a print edition. We just couldn't. Physically, we couldn't do it. I didn't want to risk the health and safety of our employees to do that. So we went and we did an online publication for 2 weeks, and that was like June 25th and July 2nd. And really, in all the years I've been here, my 30 plus years here at the paper, it's the first time we never published a print edition. And so it was a real tough decision, but it was a decision that we had to make. And I felt good about it, though, because again, we're dealing with this coronavirus is a whole different, unique kind of situation. And we handled it well, I thought. So we did. We let the public know that we were coming out online only. And we did. And I thought we did a really good job. I thought our paper looked really sharp. If you went to the online, to our website, and you accessed our paper, it just boom, it just stood out right there. But we also got a lot of, pushback from our people. A lot of people couldn't understand why we weren't able to present a print edition, especially the older generation. They were saying, well, we don't know, we don't have a computer, we don't have internet, we want our paper. And so we had to deal with all these different factors. But in the end, I felt good about it because it was something that we did because we had to. But it also allowed us to realize that if something like this is to happen again, or looking down the road where everyone's going digital these days, we can do it. We have that capability, and we have the tools and the people, the staff to present a really good digital publication if that's what we're going to do. I still think we have a long life as a newspaper still, an actual print edition, but it really opened our eyes as to what we're able to do when it comes to working with the internet, working with technology. It was a learning experience, but I was really proud of our staff, of the way they handled it, and we're still dealing with trying to make amends with the people who didn't get the newspaper. We're still trying to say, hey, that's something we had to do and explain. And I wrote columns, we've gone on the radio, we've done a variety of different things. But then it also kind of felt good hearing from the people because they wanted the newspaper. It made me feel good knowing that there's people out there that appreciate the work that we do, and they were looking for the paper and they missed it when it wasn't there. So, you kind of taking some good from the bad, so to speak. But that was a unique experience, and I thought we handled it well. And hopefully we won't have to do that again, though. But you never know with this virus; you just don't know. That's the thing about the coronavirus is it can hit you at any time and in different ways. But because of the guidelines we have in our office and the way we operate with our staff, they work remotely, most of them, and people aren't always here, when they don't need to be. Only when they actually have to be here at the office that they're here. We've kind of got a good gauge on and handling, how to be safe and trying to avoid any of those kind of situations. But it's tough, and it's. And I think anybody that's in the industry realizes that when we're out in the public and going and talking to people, we're always at risk. And so, that's kind of like how we dealt with that situation.
Just real quick follow-up. Is there anything you would do maybe slightly differently or the same the next time and that you would recommend? I think Naja has a lot of people who run public publications as well in their tribal communities. They might want to know.
Yeah, when it happened, it hit us like at the end of the week. And so we only had a short time to really plan for what we were going to do. And then we also had a short time to get out the word to the public that, hey, the print edition is not going to come out. So if there's anything I could have done differently, I would have probably really pushed getting more public, information out, using technology, using the radio, however we could let people know, we're not going to be out next week, and this is why, And but other than that, like I said, I thought we handled it as best as we could, and but we're glad to be back printing again, though. That's what we do.
Extraordinary times.
Yeah.
Noel, as a reporter, you have to do a fair amount of planning in a different way, and maybe now more than ever with more stories to cover and not always a lot of time. I guess I was wondering if you might tell me about kind of what you have seen as coverage priorities in the last several months, and how you've made those decisions.
I would say definitely anything related to coronavirus, as far as updates in case numbers or orders that might be coming from the tribal government. Like within this last week, actually yesterday, Navajo Nation President Donovan extended the closure for the executive branch. So that for me took precedent over everything else. So I spent yesterday morning just focusing on that. And once I filed that story, I jumped in on the teleconference meeting that the Navajo Nation Council was having because they were meeting in their summer session. They kind of just, in a way, learned what is going to be the important stuff. So like when the Mexico had its first case in March, our newsroom just basically shifted to, we're going to cover this coronavirus and see where it goes. And it was like 3 weeks of nonstop updates in relation to this virus, whether it was new cases or new mandates from the state level, the county level, the city level, the tribal level. We were just going. And we have 6 people in our newsroom, and that includes the editor, and we're covering the whole entire San Juan County. And so We have Farmington, Bloomfield, Aztec, Kirtland as part of our coverage. And for me, it's the portion of the Navajo Nation that's in the county. So we're looking at several chapters in the Northern Agency. And of course, we have our crime reporter who's looking at how are courts adjusting to this? How are they going to handle cases? How are the police, handling arrests at this point? Because we're trying to figure out how this virus transfers between people. So, what type of safety measures are public safety people taking continue doing their job? So, I mean, all of that was like the priority. And at the same time, I did have some community members who were like, hey, we have these events coming up, or hey, we have this issue in our community coming for us, and we need that to be addressed. But it was like just explaining to them that right now is not the time that I can drop what is the main story, which is the coronavirus, and focus on what's going on. And luckily they were, understanding. And I told them, I can always touch base on you when things get quiet, or because who knew how long this was going to last. But it's just kind of like that learning process, and just trying to get the word out to the readers of what is going on in their community, especially at that government level. And now it's transitioning to where we have more people not wanting to comply with the mandates as far as like wearing a mask. So that's a whole other part of this issue that's developed and is taking the focus.
Your point reminded me, I was curious how you as a reporter in this time have, I think you've been a reporter in your area for years, how you've sustained contact with your sources and communicated with them, about to keep on top of stories and make sure they know you're there to listen.
I think it's just taking time to listen to them, when they call, what they have to say. It might not, it's important to them, what they are saying, so it's important for me to listen. And if they are understanding of something that they maybe have read in our paper, trying to take time to explain it to them, to get them to understand it. And just even listening to them complain about something small that's happening in their community. I don't mind taking that time out. And if it's going to take, ideally we would love conversations to end in 5 minutes, right? But people tend to draw out the matter for 30 minutes, and I'll just take the time out to do that. Now, if I'm a deadline, it's a whole other matter, but I think it's just having that point of communication, being interested in what they are saying and what issues they're bringing to you. And I think a lot of it also is just how I approach the stories and how I try to present it in a roundabout way. I think some reporters who were in this position before me kind of, I think in some readers' eyes, failed to do that or to make that delivery. And
I also wondered, like in this time, I think companies, and Tom talked about just a little earlier, like the trying to take care and work from home, and then do a lot of our reporting by phone or online, or different, Zoom potentially. And I wondered how often you may have gone out into the community, and why, even during the pandemic, and why specifically for your coverage area you felt like that was necessary or important in different instances.
At this point, I try to go out to the community at least once a week. Like this week, I haven't gone out anywhere because my focus was the tribal council session, and that was on available online. So I've been at home just listening to the session. But I think it's important that I go out into the community because I know I'm going to get a more fuller story. And people are going to be more open to talking to me face to face rather than on the telephone or through email. I think that commitment to the communities is what I'm fulfilling as a reporter in doing that. do I get worried about my my health, or it comes across every once in a while, but I can't let it stop me. I mean, I take um, faith in that. You know, if I wear when I wear my mask, and you know, I practice social distancing, I'll be okay.
Yeah.
And I think people appreciate that I go out there still and talk to them, get their side of the story.
To the question, oh, sorry, I didn't mean to interrupt.
No, go ahead.
Kind of to this point that Noel is bringing up, or had about, you know, having some pretty constant and quick deadlines, maybe especially, or news coming out, especially, you know, maybe earlier in the spring. But the idea that this coverage is continuing for months, and it probably will continue for months more. I was curious for the whole entire group, before I move on to other panelists, but for all of you, like, how have you, because I think this is important, like, how have you avoided burnout, or how have you taken kind of measures to sustain yourself, or maybe an alternative, if you feel like you want to offer alternate advice, like maybe how have you navigated through moments that, like, the wall hit you and you needed to take a break? So the floor is open, I hope, on that one.
Well, let me say that, you know, with our staff, we've got a small news staff, and we got a huge area to cover, you know, the reservation and then all the border towns and then beyond that. And so our staff has to put in a lot of miles traveling when they go out to cover a story. And Noel talked about, she made a really nice comment about fulfilling you know, a role of being out in the going out to your community. And we feel strongly about that. You know, we want to be safe, but we also know, though, in order to get the story, in order to get to really talk to the people and hear what they have to say, we actually have to be out there. And they appreciate that. When they know, you know, Navajo Times is at the chapter, you know, people will come and they share stories. You'll go out there to maybe get 1 or 2 stories. You come back with 10. But, you know, and our staff realize that, and it's a 24-hour job. You know, there's things that are happening all the time. And like Noel says, there's other things happening too besides the coronavirus. And so you have to have some kind of balance, because you still have life's still going on. There's a lot of other things happening in the community, at the schools, you know, in the courthouses and that kind of thing. So our staff, you know, I've always emphasized having some balance, harmony in your life, making sure that, you know, you don't overdo it. And it's easier said than done for some of our staff, because like Donovan is driven. He'll go until he gets the job done, you know, and I always had to basically, you know, practically take his car keys away from him so he'll go home and stay home. But they're, you know, staff are all different in how they approach their job and what they want to do. But we also, you know, help support our staff by encouraging them to take time off. You know, we actually applied for the PPP, the Payroll Protection Plan, and we got some money for that. We actually were granted, you know, some money, a grant for that. And so we utilize that for our employees to take time off, to go spend time with their families, for themselves. And then we emphasize taking care of themselves physically, mentally, and spiritually. You know, you want to go get help in the Hogan or the teepee or in the church, whatever's going to, you know, you feel strongly about and what's going to help you. We say, you know, go do that. And so you've really got to support your staff. And I take a lot of pride in making sure that that they do take care of themselves and take care of their families, so that way they're not worrying about what's going on at home. There's just a lot of different facets to go on in trying to make sure that your staff are taking care of themselves. But I think it comes when you can build that relationship with one another, you establish trust, you support one another, and that's what we do. And you have to, you know. That's what I want to offer.
Okay. Thank you.
Mm-hmm.
I'll take a swing at that question. So I think at Indian Country today, I'm really grateful for our leadership team, who has, you know, encouraged everyone, the whole team, to, you know, take care of ourselves, our mental, physical. And I know there are a couple instances where I had to call Mark, and I just like hit my wall. And then I said, I don't want to do anything. I'm so emotionally exhausted. I need like, the half a day off. And he was very understanding in those two instances. And I think what Tom referred to in Donovan, I think a lot of us push ourselves, but it's also, I think, our jobs to recognize those our own limitations, or at least know that, we can't do our jobs if we don't take care of ourselves. And I think that was definitely a hard lesson to learn, at least for me personally, because on the weekends I'll be checking Slack, or I'll be, on Twitter scrolling, and I had to, limit my screen time, or just leave my phone someplace, or, and intentionally lose it so I don't look at it. Or even just, Netflix is one thing that helps, but it's also looking at a screen for me. So getting outside, and that's a challenge too in the city, because people, it's also stressful because people are walking by you and you have to, keep, your distance from them. But I think in the beginning it was really fun for me, at least, because this is where all my interests kind of converge. I love covering, public health, medicine, and then I dealt with like the stress of it by exercising, by having dance parties, by talking to people. But I think as, it's, we kind of realize this is going to be a long-term, thing that's going to be happening. When our managing editor, Katie Owen, kept reminding us, this is a marathon, not a sprint, slow down. And all of us had to kind of take a breath and recognize it, and take time off too, or even just tell each other, like, don't call me this weekend. I'm working from here to here, and drawing those boundaries with one another. And we're definitely very understanding, because again, you can't help your community or your audience if you don't take care of yourself.
Thank you, Jourdan. I would like to move on to Donovan, unless anyone has more to add. So Donovan, we'll start with, I'd like to get back to the question of how you kind of approach your stories, especially being a photographer, which you absolutely have to go into the field almost, I'd say 99% of the time. That has to be the decision that's made to get your photo. But before I do that, I actually wanted to ask you, I think over the course of the last several months, like many of your colleagues, have had to write a full array of stories, and you've found new angles and wanted to pursue new storylines out of your community. Some of that has involved historical and cultural context, and I was hoping you might tell me why you pursued those stories, how you pursued them, and why you think they're important.
All right, thank you for having me as a panelist. I appreciate that, and thank you, Tom, for speaking on our little staff's behalf. Well, I think for me, the reason why I focus so much on the cultural side, traditional side, is because, well, first off, I'm Bennett, I'm Navajo. I have roots here in this area. I grew up in the area pretty much, and I really care about who we are and then what's going on. I've always cared about that. I've had plenty of opportunities to get out there in the world and present news from other angles, but I chose to come back here to the Navajo Nation, where I come from. And I think that, throughout the years, that's what I've always done. I've always felt privileged that great folks like Paul Matanaba, who, asked me to get on staff, and I got on staff, and then, he laid down a very great path for me to try to improve on. And I hope I'm doing my best, first off, and I hope that whoever I pass it on to will also do the same as well. Now, from the cultural side, for myself, I'm a traditional person. Like Tom was saying earlier, for me, it's about I do my best to approach everything from a traditional standpoint, not necessarily from a scientific standpoint or from a popular standpoint. And from the historical standpoint, I've always been interested about who we are as Navajo people. I've always felt that mainstream history has never really spoken about indigenous history so I've taken it upon myself to try to educate myself and try to learn as much as I can about who we are. And then in turn, I try to convey that back to our people, because I believe that the more we know about who we are, the more we empowered we become. So that's what I've been trying to do. So when the pandemic hit, So when the pandemic hit, I'm sorry about that. I think, of course it hit, just like everyone else. I believe it took over. It took over everything. It took over my life, as far as the news I covered, my life in general, pretty much, listening to what was going on out there. And then of course I switched back over to trying to approach this from a traditional standpoint, historical standpoint. So I started talking to who we call Hudetz, or, in very general, broad terms, we call them Navajo practitioners. Although, some will say that's not what we're called. But for this panel discussion, I'll go ahead and refer to the Hudetz as Navajo practitioner. So the Navajo practitioner basically looked at it and they basically just said that that the pandemic is something that is human caused. Obviously, I think that science agrees with that as well. But I think from a traditional standpoint, I lost my train of thought here. I'm sorry.
Oh no, take your time. I do know. Oh, go ahead.
I'm sorry, but I think it'll tie back into how I take care of myself. We have the corn pollen or the Fetidine. I referred to that. I went to that and I prayed, and I listened to the Navajo practitioner, and basically what they're saying is what I try to convey back to the people, and that the reason for that, again, is because it's to remind people, our Navajo people, that, we've been through a lot. We've been through a lot, including dealing with diseases out there, especially during the 1864, 1868, what I call concentration camp times, or a lot of people call Hudetz or Bosque Redondo. So I wanted to let people know out there that, that times are different. We're all forced to live in a certain way now. That doesn't mean that, life is over, or life has become a lot harder. It just, in my opinion, it just got a lot more complicated. So I think for me, I wanted to let people know that, if whoever they choose to turn to, at least from a traditional standpoint, people can turn to the Fetidine or the corn pollen, and turn to that and go back to living in a way that's helped our people, my people, live throughout the years and persevere.
Thank you. Thank you very much for that. I wanted to also ask you, and maybe these go together in a way that you see, or what you'd help me understand, but how then also on a day-to-day level, like, how do you take care of yourself? Like, maybe what are some of the steps you take as you go through your reporting process? Like, you're getting in your car and you're going to your assignment. And I know, as was the case across the United States early in the pandemic, there may have been PPE shortages. Just how you got through some of those instances, and maybe what you want other journalists across the country to know should they find themselves navigating a similar challenge.
Okay, thanks for that. Well, as far as how I take care of myself and how I prepare for my assignments, basically I have a truckload of PPE that I've been using over and over again since everything started. And thanks to great people out there, good people, good-hearted people out there who have gone out of their way to donate some of their PPE to me. I just cannot thank them enough for doing that. Like you said, that's a huge issue as far as the shortage goes. But again, people out there, they at the beginning when the pandemic first started, I debated whether or not I should go out there, but after hearing some stories about what was going on, I decided that I couldn't just sit back and just report from my house. I needed to get out there. Plus, like you said, I am a photographer too as well, and the images, I needed to get those images too as well. And so basically, I just started going out there with a handkerchief right off the bat. Thankfully, my mother too, she's a retired healthcare worker. She just happened to have some surgical masks at the house, so I started using those as well. But basically, it's because of the good-hearted people out there who have been kind enough to donate some of their PPE to me that I've been able to get out there and report and get the images that I need to go with my stories. So that's pretty much how I take care of myself. I feel that, being a journalist, transparency is a big thing for me, and that it's absolutely important that I let my sources know, people I'm interviewing, know that I am taking care of myself, that our staff is taking care of each other, and that they're taking care of themselves and doing everything I can to tell the best news, that the most relevant and hard-hitting news, impactful news that we can try to tell. And so that's pretty much how I've been approaching it. I think that, but as time goes on, more and more of us being people, we're starting to contract the virus. So I've had to reevaluate how I approach the news. For instance, there was a fire here that happened recently, and I had embedded myself with the fire crew. A day later, they told me that one of the firefighters had contracted the virus, so I had to basically sit back. But thankfully, all of us were wearing, our PPE. We were outside. I was probably at a minimum of 20 feet away from the person that they told me about for a moment at that, maybe 5-10 minutes at that. So I felt pretty confident that I'd be okay. But they told me, but that made me think that trying to keep myself healthy out there is becoming a little bit harder, a little bit more complicated. So I need to be more careful. So, and the PPE that I have, continue to use it, of course, and then so just practice all the safety measures that CDC has recommended.
Okay. Maybe one quick last question for you. And if anyone wants to jump in on this one also, that's welcome. But I wondered if of all the times that you went out into the community and, for photographs and stories, if they're maybe looking back on this year, years from now, is there any one particular photo or experience or interview that you think may stick with you, and would you be willing to share it?
Sure.
Okay.
Well, I was parked at the local grocery store a few weeks back, and since we've been covering so much sad news and quote unquote negative news, I felt that I really wanted to shift my angle and focus on things that look more positive, So I found this family sitting in the back of their pickup truck, and it reminded me of when I was a kid. We would park off the road and we would eat our food there. That was just something that we did as Navajo people, as I know my family did that. And I saw this family eating in the back of their truck, so I thought, hey, this would be a really good image to get, But it turned out that the family had just gotten done searching for their loved one who had been missing since Mother's Day. And I felt, again, it wasn't exactly, it wasn't a positive image after all. It turned into a story that is another epidemic that's affecting our indigenous communities out there, missing word indigenous relatives out there. So that was that image comes to mind immediately. Sadly, the family did find a loved one, and he had passed on, so it wasn't a positive outcome. So,
Yeah.
but that's the image that comes to mind.
Sorry to hear that. But it is speaks, I guess, again, as noted earlier, the extraordinary times that we're in, and also the merging of crises sometimes, or the existence of them simultaneously. If anyone wanted to add to a memory or a especially memorable assignment, I welcome that, or else I'd like to ask Jourdan about some data collection, which is yet another huge front on this story.
Well, can I just offer something real quick? And it's something that
Yes.
there's not any one particular time. Well, actually, I take it back, because, you know, right when the coronavirus started, my dad was in the hospital, and eventually my dad passed away. And as a result, though, of when he was there, the first two people that came to Rehoboth McKinley Hospital, where he was, the first two people that tested positive were admitted onto the third floor where he was at. And so they had to quarantine the whole floor. And as a result, we didn't get to see my dad anymore. And eventually he got, put into intensive care, the ICU, and we couldn't see him. We couldn't do anything. We were helpless. We couldn't help him. We couldn't go talk to him and try and comfort him and support him. And I've come to realize since then, this is back in April, early April. Since then, I've read so many stories, not, stories that have been printed, but I'm just talking to people where they've all had that same helpless feeling. People literally have died all alone in the hospitals from the corona. And then other diseases as well. People who don't have the corona, who might have something else. But because of the corona, nobody can go see them. Nobody can be with them. And that's a really sad situation. And so when you see like old grandma talking to you and crying, it just breaks your heart. And so if anything stands out, it's that feeling of helplessness that people have, and that they can't go and be with their loved one and try and help them like they've always done, like they've known, like they're, you can pray, you can do all these, but to actually go physically and be there and say, Shema, and talk to them and try and bring comfort and be with them in their last, the last few hours of their life. I was fortunate that the doctor allowed me to go ahead and go in right at the end. And so I was with my dad when he took his last breath. But there's a lot of the people that didn't do that. And I wrote a column about it. And I really felt strongly about it. So I wrote. And since then, I've gotten so many comments from people who said, we this is what happened to us. We couldn't do anything. People who lost their grandma and their sister and their uncle, not just one relative, but several. And in every instance, they weren't able to go talk to them and hug them and wish them goodbye. The next time you saw them was when they were already gone. It was just, a body, and it's sad. And but that's some of the things that we have to grapple with as a people and as a newspaper person and a journalist. It can break your heart, but you gotta, you want to tell your readers we're there for you. We understand what you're going through, and as we're human beings too, and we experience the same thing. So that's a great question, and there's a lot of other things we could talk about, but for me, that's one thing that really stood out. And again, because from a personal standpoint, but also because of what has happened with all these different stories I hear from people, and it's sad, but it's reality. That's what's happening.
Yeah. Oh, really great points all around. And I think the connection between your own experience and the readers, I think just shows exactly like what I said earlier about the power here of community, local, and especially Native journalism.
Sure.
So Jourdan, I think one of the things that is always an issue for Native people and for tribes and for Indian country is data collection. But maybe that has become starker than ever in the last several months. You began collecting data early during the crisis. Of course, data collection is important for decision making. And of course, then that's kind of where the impact comes when we don't have it. I was hoping you could tell me about how you began to collect data, and what your findings were and how you worked through also some hurdles.
Sure. So it was about mid-March when we first heard the, I guess, the first tribe-related case that happened, but that case wasn't, it was a non-native individual who was not seen at IHS facility, but that's when I guess the idea kind of sparked. And then from there, a lot of our team members, we're all connected to our own individual communities or even relationships or networks we already have existing. And we just started seeing, notices pop up on our own social feeds, and we started sharing that in Slack. And I think after about 2 weeks, I realized that, it actually kind of came out of curiosity that, IHS at the time wasn't doing a daily update. Now they are, doing a really great job with it. However, they only break it down by regions. And so that wasn't, from what I was hearing online from other people, that wasn't the data that people wanted or didn't give them enough information. And so I thought creating the spreadsheet, maybe, it would be neat to kind of collect and see what comes of this. So I just started a spreadsheet and try to keep in mind too, what data we were limited by as well. What was the fine line between it? What is already publicly available? And by that time, a lot of tribes already sharing their cases by press releases sending to us or by email sent to us. A lot of their press releases and announcements are on Facebook or Twitter, and that's how a lot of tribal nations are communicating with their tribal citizens, is on social media and through radio also. We would go to radio station websites, tribal news as well. So there are a variety of other ways that we're getting this data, but it's all publicly available. So we just threw it onto a spreadsheet, and I think after my first intention was really funny. I thought to create something just to keep track of, and I shared it with our team, and then Mark Trahan, our editor, was like, "Oh, let's just put this out there, so people can see." And it was just the point of how valuable data was and how this already didn't exist. And I thought, oh, it's a great idea. And so it just kind of just started coming together. And it was daily check-ins with each tribe. So the way I guess that we go about it is initially, it was just collecting, spurts of data here and there from where everybody was from, the Pueblos, Ho-Chunk, Navajo, up in the Pacific Northwest. There's really no, trend to it other than what we would find. And then once those kind of stopped and it's kind of stalled, I started thinking we need a more comprehensive data. So I started looking just at different states and different nations, and different, tribal nations, different states. And I would go to the websites or their social media, and I would give them a call. So it's more of us going to them, which is a lot of man hours. In the end, it's a lot of calling people. It's a lot of also establishing relationships too. And I think for me, I was really lucky, and I already kind of had a health background, so I kind of knew data that I needed, and who I would needed to talk to already. And I've already established relationships with the health or medicine community from the last year. So those kind of helped me because I kind of knew, and they directed me toward the right people. So that definitely helped quite a bit. My guess, if you want to look at a daily of how it works, I wake up in the morning, check, press releases, check my emails, check our press polls. I have a list of people I call, or tribes that I now check in with, and Cherokee Nation is one of them. They update it daily. Pasquayaki is one of them. Mississippi Band of Choctaw Indians is also another. So it's just collecting, the cases, the deaths, and entering them in the system, and doing the math right there. But I think a lot of it, the challenges are, it's a lot of hours, it's a lot of calling people, it's a lot of emails, and it's also, interpreting the data too, because a lot of times, we have to get this right, because once you put it out there, it's already out there. But it's also the beauty in it too, is that we show our homework, and I think that's what a lot of people appreciate. People wonder, where are you getting this data? The link's right there, they can go and find it themselves. And so that transparency is also part of building trust with the audience too, which desperately I think is needed right now. And again, it's not data that it's already out there. It's on social media, it's publicly available. All we're doing is just grabbing it and putting it in one place right now. But I mean, it's just really, and entering the data is also another hurdle in trying to gather this, because right now I'm the only one. There's another epidemiologist that's been offering me to help. I just haven't showed her how or talked to her more about it. And I mean, it's been a great tool overall. I think, there's definitely some hurdles, and I think just seeing the trend, or seeing over the past 4 months what has happened, tribes are definitely doing a great job in evolving with the data, and the data is evolving. Like at first, they're only recording the positives, negatives, total, and maybe some of the deaths, but now they're breaking them down into tribal citizens, non-natives, if they're within their community, if they're not in their community. So there's a lot of nuances to this data collection, I think, that mainstream media doesn't know about, that we're catching on to as well.
Okay. So many questions I want to ask, but maybe if there's just one follow-up here, and then maybe a chance during the Q&A with audience, but what to you, like, what is the importance of this beyond numbers? As a, someone who is from, I believe, you're right in Noel's coverage area near Farmington.
Yeah, I'm from Fruitland. Can we get specific?
I was gonna say Fruitland, but yeah,
yeah,
I was not 100% sure.
Yeah, I think it's just, it's, each person is a story. I think looking back at the pandemic that happened in 1918, there's really nothing that existed of our people. And the fact that, we don't want to be passed again in this time, because we're here, we're existing. There are treaties that need to be upheld that are shining, and those obligations are not being held up by the federal government are shining through right now more than ever before. It's been there already, right? But now it's shining through, and people are finally noticing, which is sad. It took a pandemic to have everyone realize that's what's happening right now. But also, I think what is really important is, like, we record portraits of those who have died from this pandemic too. I think that's a really important part of the story. Like Tom was saying earlier, it's really sad that a lot of these individuals are passing on, our elders, our grandmas and our chays, and it just breaks my heart. Like, so part of our data collection is also the cases and the deaths, and I think it really hit me when in one day I recorded 10 deaths across like Indian country, and I didn't really realize that until I started seeing Facebook posts about people and hearing their stories, and that's when I broke down and just cried and realized, like, the work we're all doing is so important. And as well as this data collection is, each person was loved by somebody, and somebody loved them, and they are aunties and brothers and cousins and mentors, and their stories are so important and need to be recorded.
Yeah, really strong point.
Yep.
I think that moves us. Thank you so much, everybody, to the audience Q&A portion. Really powerful panel, though, and I appreciate this as a starter for the discussions Naja is holding. It looks as though there is one question directed toward Tom, and from the very start of the conversation is, were most of your readers print pre-pandemic, or do you have, I guess, to fill in the void of that question is, do you have very many digital only subscribers too? Or are they mostly print?
Our majority of our readers are print,
Okay.
but our digital subscriptions are going up all the time. And really ironically during this pandemic, we've seen an increase in people subscribing, to our e-edition is what we call it, And but majority of our readers are still people who want to get that newspaper in their hand and be able to look at the images and read the words and drink their coffee at the same time. So we've still got a real good, strong readership. Right now, our paid circulation is like around 13,000, which is Probably it's not the lowest we've ever been, but it's low for us, you know, but it shows that there's a transition going on. We do have more and more people getting their news, you know, online, and we're starting to see that now with, you know, with the Navajo Times. But I think, you know, in Indian country, and I think a lot of the minority-owned media still have that real strong niche audience where, you know, what we present to our people is unique. They're not going to get it anywhere else. You're not going to get it in the New York Times. You're not going to get it, you know, in the Arizona Republic. You're going to get it from the Navajo Times. You're going to get it from Indian Country Today, from Showband News. Our audience, you know, are unique, and they appreciate us, and they need us, and we need them. And so I think that's, you know, to answer your question, yeah, we've got more print readers and way more than online subscribers, but we're seeing more of a transition now where more and more people are subscribing online. Okay. Yeah.
Yes. Thanks for that.
Uh-huh.
I see one welcome the Naja staff to send to me as well. If there's any I'm missing, I have one window pane here. But from Nanette Kelly, who's from California, and she asks, or I believe from California, she finds it more difficult than ever to contact tribal governments and their representatives. And she's worked on solutions at reaching people, but she wonders if you have any tips that have worked well for you. This might be a key question for reporters. Any ideas are appreciated, she says.
I think Noel's knows all the tricks to that one. She can tell you.
Oh, I think you might be on mute, Noel.
Okay.
Oh, there you are.
You know, you just find roundabout ways to get a hold of people. I mean, push comes to shove, you just have to go to where they're at. You know, there are times that, I mean, I got actually my start at Navajo Times, so I'm familiar with Tom and Donovan both. I mean, Tom was my boss and Donovan was my colleague. So, you know, working there for, I think, almost 4 years, I covered Navajo Nation Council, and the way especially the staff, definitely the staff, how they got to know me was that I just showed up at meetings every day. That was just my life, going to meetings, coming back to the newsroom, trying to digest what I heard and saw and try to understand it all, because I didn't know how Navajo Nation government worked, and just showing, you know, being there, asking questions, talking to delegates, asking them, you know, why did you vote that way, or why are you sponsoring this bill, like, and asking them even the history part of it. Some of those delegates have sat on councils for more than one term, so they've seen the history and the development of government. Even in the newsroom, you know, just talking to some of the veteran reporters, like when Marley Shabala was there, Bill Donovan was there. I mean, they were in the trenches in the 80s and the 70s, you know, even Tom, you know, Tom's old school, you know, talking to him, and it's just that curiosity. So, I mean, just being out there and developing that relationship. And then sometimes it doesn't work, you know, there's some, you know, there'll be some new people on council who don't want to talk to you, but you just keep bugging them, find phone numbers, find emails. There's a friend of a friend who might know how to get a hold of them. Reach out to that person. You know, that's all. That's what you just have to do. I can't say there's like one solid solution to getting a hold of people. It's just being out there and showing them your face and your name and talking to them like they're the average person.
Thanks, Noel. I'm going to get it really close, but maybe just do one more audience question. This is from Araceli Martinez with La Opinion in Los Angeles. What have you learned during this pandemic that you will use once this is over? And have you been impacted economically? One or both. Answer to one or both if you're willing.
I think Zoom is your best friend. I think Zoom is your best friend, because, I mean, we actually started a broadcast during this time, and that's how we've been making it happen, right? but it's also realizing, you know, as we are reaching sources, we are having broadband issues. So it's also, you know, a testament to what else is going on. But hopefully that answered the question. I think it went away. So
I think that's great. You're right. The Zoom panels you guys have done is great. I am sad that we're right at the 2 o'clock mark, which means I think we should wrap it up. I think Brian had a couple, maybe Naja, which is Brian, who is Naja, has maybe one last announcement to close us out. And I'm just really grateful again to you all for joining. Honored to have you as colleagues, Naja, as fellow Native journalists. So thank you.
You're welcome. You know what, everyone, keep on doing the great work that you do. You are essential. All of you, every one of us, we're all essential.
Thanks. Yes. Thanks for having us on.
Over to you, Brian.
All right. Thank you, Mary, and thank you again to our panelists. This has been a great discussion. We definitely appreciate everyone's time and the generosity to appear with us today. And we wish all of you the best as you continue to cover these really important stories. I'd like to thank everyone for attending, and be sure to watch for announcements about our future roundtables in this series. And so for those of you that have not subscribed to our newsletter, I would encourage you to do that. You can go to naja.com and sign up for our newsletter. And that concludes today's Covering COVID-19 in Indian Country virtual roundtable. We'll see you next time.